Hi guys, welcome back to my channel. So today we are going to discuss about histamine. The previous class we almost discussed about what are the autocoids, what is the definition of autocoids, and what are the classification of autocoids. This one, autocoids are the substances that produce a wide variety of the cells in our body and that having a intense biological activity of our body or in our body. So histamine, it is also a type of autocoid. It comes under first classification, that is amine autocoids. You can see here amine autocoids, histamine. So we discuss about this histamine in very detailed manner. So it is most important to very like B.Pharma students, mainly in the 5th sem B.Pharma students. Every year they ask a question, write the pharmacological action of histamines or histamine agonist or histamine antagonist. Okay, so we start this class about histamine. Yes, so histamine. What is the histamine? Histamine means histamine means tissue plus amine. Okay, you can go into understand afterwards what is the site and location where this histamine is present in our body. The primary site of histamine is mast cell granules or basophils, skin, intestinal, gastric mucosa, lungs, liver and placenta. These are the primary site of the histamine. And other than primary site, other sites that can be histamine present in our body, that are CNS or funds of the stomach. In CNS, as a neurotransmitter, funds of the stomach, major acids secreted in epidermis, gastric mucosa, growing region, poison, etc. in funds of the stomach and CNS other than the primary site. So main site of histamine was mast cell granules, also called as the basophils. Next we move to the synthesis and metabolism of histamine, how the metabolism get synthesized or produced in our body and how it get metabolized in our body. So synthesized by decarboxylation of amino acid, that called as the histidine. So by decarboxylation of histidine, the histamine get produced. So you can see here histidine. What is this? This is the type of amino acid. After decarboxylation of histidine, histamine gets synthesized in our body. So you can see here, for example, amino acid, after decarboxylation, amine is get produced. So here amino acid is histidine, that is almost present in our body. We all know the total 20 amino acids present in our body. Histidine is one of that amino acid. After decarboxylase by L-histidine decarboxylase, histamine get produced in our body. Okay. After synthesis and metabolism, distribution and storage, where it get distributed and where it can be stored. So histamine, it mainly stored granules of the mast cells. So here we are almost studied now what is the primary site mean, mast cells granules. So yes, it is stored in the granules of the mast cells. And tissue rich in histamine, which are the tissue that contain more amount of histamine, that are the skin, gastric acid or gastric area and intestinal mucosa, lung, liver and placenta. So these are the more tissues where the tissue present in these all organs now that contain the histamine. Okay, next we study the major actions of and pathophysiology roles of 4 types of histaminergic receptors. So first we know about the receptors. So you all of the people know about receptors. So histamine also have a receptors that are divided into 4 types, which are H1 receptor, H2 receptor, H3 receptor and as well as H4 receptor. These are all the pathophysiological roles or mechanism of action of this H receptors, also called as the histamine receptors. So what is the role of the H1 receptors? We study in detail. H1 receptors that causes the vasodilation. The primary of this H1 receptor action is smooth muscle contraction. It contracts the smooth muscles by increasing in calcium produced in our body, it causes the smooth muscle contraction. After smooth muscle contraction, that causes the vasodilation. After vasodilation, the more effects are produced in our body, such as increased capillary permeability, like extravasation, like edema, then in adhesion molecules, inflammatory cell migration. This all causes the allergy reaction. So H1 receptor is responsible for the allergy reaction in our body. Next, move on to the H2 receptor. The main work of the H2 receptor is it involves in the gastric acid secretion in our body. It main act on the gastric acid secretion in our body. After gastric acid secretion, what happened? It increases the gastric acid secretion, smooth muscle relaxation, cardiac stimulation. So these are the action of this H2 receptor. Main action is gastric acid secretion. H2 is gastric acid secretion. One is allergic reaction. Third one is very not so much useful, but it is type of H3 receptor. It acts on the neurotransmission in our body. It is not like harmful receptors, or it don't causes the any harmful effects in our body. It mainly work on the neurotransmission that helps in the neuronal histamine release and turnover. Like autoreceptor, it releases the histamine and also it gets synthesized and the metabolism of the histamine autoreceptor and turn over the of other transmitter, wakefulness and conjunction. This is the role of the H3 receptors. H4 receptor, it is also helpful in the immune inflammation. It causes the immune inflammation. What are those means? Immune cell chemotaxis, cytokine secretion and immune inflammation. It is responsible for the immune inflammation. Also we call that the immunity inflammation, or it causes a decrease in the immunity. So 4 receptors, H1, 2, 3, 4. H1 responsible for the allergy, 2 for the gastric acid secretion, 3 for the neurotransmission, 4 for the immune inflammation. So for your B.Pharma students, you have important 2 receptors, that is H1 and H2. Okay. So important, right? See here, I also write here important H1 and H2 histamine receptors for your syllabus or for your examination. Next, what are the pharmacological actions? Pharmacological actions of the histamines or histamine receptor. We can study one by one. First, it has an effect on the blood vessels, heart, visceral smooth muscles, glands, sensory nerve endings, autonomic ganglia and adrenal medulla, CNS. So what the pharmacological action means, you understand, you people understand, all pharmacy graduates. Pharmacological action means effect of the any drug or any substances like this autocourse or any substances on the various organs or various parts of our body, whether it increases or decreases the secretion, dilation, contraction, whatever the effect that those drugs had on our organs, that are called as the pharmacological actions. So what is the action of histamine that causes in various organs or muscles? We can also call as the particular organs or muscles. So in first, blood vessels. What happen in blood vessels means histamine that causes the dilation of the smaller blood vessels. What it causes? The dilation. It dilate the smaller blood vessel, including arterioles, capillaries and venous. So that it causes the dilation of the smooth muscle, means opening of the smooth muscles. Next, it also increases the heart rate, cardiac output with little no fall in BP, means it increases in the heart rate and cardiac output, but it do not affect on the blood pressure of the of our body. But rapid intravenous injection of histamine that causes the fall in the BP. Yes, of course, you can understand here. Once we given now histamine slowly, like oral, for oral administration, so that causes the slowly release of the histamine in our body. So do not causes the suddenly fall in the blood pressure, but rapid IV injection causes the fall in the BP, decreases in the blood pressure. Also causes the vasodilation by H1 receptors that located directly on the vascular smooth muscles. Yes, you can see here H1 receptor that causes the vasodilation. Yes, so here H1 receptor causes the vasodilation on the vascular smooth muscle. Larger arteries and veins are constricted by histamine. Yes, here we can see now smooth muscle contraction, capillary vasodilation increases capillary permeability, inflammation, cell migration. So these all also we can write them as the pharmacological actions of the histamine. Yes, and H1 receptors that also increases the capillary permeability. We see here now increases capillary permeability, vasodilation, smooth muscle contraction. These all also a pharmacological action, that action on the blood vessels. Increase the capillary permeability due to separation of the intracellular scale, induction, escape and leakage. Histamine elects, this is the main point or main pharmacological action of the histamine, that histamine elects the triple response. Triple response, what is this triple response means? First one is red spot, wheal and flare. It causes the triple response by administration of the intradermally of the this histamine injection. What means after we inject the histamine, intradermally to the skin, it causes red spot. Slowly that red spot is spread into the area. You can see here it. So this is the first 3 to 15 seconds after the injection of the intradermally histamine. It do not produces any red, like it just causes the red spot, but in the area of the skin and tissue it do not damage. After 20 to 40 seconds it causes the spread of the red spot and damages the tissue. This condition called as the flare, wheal. And third one is flare. Time 1 to 3 minutes, it spread all over in our skin. That is called as the flare. So it causes the triple response: red spot, wheal and flare. Triple response in the various due to exudation of the fluid from the capillaries and veins. Okay, redness in the second surrounding area due to arteriolar dilation. So here in what is the action on the blood vessels means, it causes the dilation, smaller blood vessels, capillaries and venous, increases the heart rate, cardiac output, no fall in BP, but when we given intravenously it causes fall in the BP, vasodilation, larger arteries, increases the capillary permeability and all. For pharmacological action you can also read this pathophysiological mechanism of action of this histamine receptor. It is also a pharmacological action once you people are understand this. Okay, then effect on the heart. So what heart histamine effects on the heart means, there is no direct effects on histamine on the heart, but in isolated heart, especially in guinea pig, it stimulated. Like see, when we give histamine, no? So what is histamine? It is a type of autocoils. What is this? This is a type of autocoils that produce from the cells in our body, that produce biological activity. So it cannot reach to the particular cardiac and shows the effect on the heart. But isolated heart in guinea pig, it is a type of a laboratory animal, it gets stimulated. Guinea pig, when histamine isolated heart, when we give histamine to this isolated heart, force of contraction it increases by H2 receptor, not H1 receptor, by H2 receptors. What is the work of H2 receptors? Means it increases the gastric acid secretion. Third one, on smooth muscles. What is the effect on smooth muscles? Means it causes the bronchoconstriction. Highly sensitive to asthma patient, it causes the bronchoconstriction. That means constriction of the lungs. To those patients that is highly sensitive to asthma, the patient who have a asthma and we give the histamine to that patient, means that causes the bronchoconstriction. Then larger dose can cause abdominal cramps and colic by increasing intestinal contraction by H1 receptor. By larger doses of the histamine, that also causes the cramps on the abdominal and colic by increasing intestinal contraction, it causes by H1 receptors. On the glands, what is the effect on the glands? Means it increases the gastric acid secretion by acid or pepsin. This action by H2 receptor. We have studied here H2 receptor, gastric acid secretion. Yes, so it increases the gastric acid secretion either by pepsin, either by acid. Okay. Here one of the H2 receptor, how this H2 receptors causes the gastric acid increases, means H2 receptors that triggers increase in the CAMP, that is cyclic adenosine monophosphate, that activates the hydrogen potassium ATPase proton pump inhibitor, that increases in the gastric acid secretion. That's why it increases the gastric acid secretion. Fifth one, on nerve ending. What is the action of histamine on nerve ending? On IV, intravenous or subcutaneous injection of histamine, it causes the itching, deeply causes pain, stimulate nerve ending, and that is stimulate the nerve ending. Means after the injection of the IV of histamine, that causes the itching surrounding the area where the IV or subcutaneously injection of histamine is given, that causes the itching and deeply causes pain, that stimulate the nerve endings. And autonomic ganglia and adrenal medulla. So what are the action on the ganglia? Ganglia is stimulated and adrenaline released, can cause rise in BP. So what happened here? Ganglia is stimulated and adrenaline is released. Adrenaline is also released, that can cause rise in the BP. On CNS, central nervous system, see what happened. Previous I also discussed that histamine is the substances that released from the cells and produces the intense biological activity, because it is the part of autocoil, so it do not penetrate the blood-brain barrier BBB, so no central effects are found. So histamine functions as neurotransmitter in CNS, like H3 receptors. H3 receptors, it acts on the neurotransmitters. Okay, so what is the pharmacological action? Total 7 actions. First one is blood vessels, heart, smooth muscles, glands, nerve endings, autonomic ganglia, adrenal medulla, and CNS. In CNS, it do not produce any action. Autonomic ganglia and adrenal medulla, it stimulated and rises in the BP. Nerve ending, of course, after the injection of the IV or subcutaneous, it causes the itching and causes deeply pain. Stimulate the nerve ending. By glands, it increases the gastric acid secretion. Smooth muscle, it causes the bronchoconstriction and abdominal cramps by increasing intestinal contraction. In heart, it no direct effects of histamine on the heart, but isolated guanine it increases the force of contraction in blood vessels. It dilation, it increases the heart rate output, little no fall in BP, but in IV it causes the fall in BP, and it produces triple response, that is red spot, wheal and flare. Next we going to discuss about adverse effects. What are the adverse effects of histamine? First one is hypotension, flushing, tachycardia, headache, wheal, bronchospasm and diarrhea. It causes the hypotension, of course, it by increasing of the blood pressure. Hello, yes, it causes the hypotension, that is fall in the BP, increase in the BP, fall in the blood pressure. Flushing means redness of the skin or redness of the spray. Tachycardia, it causes the harmful effect on the heart. Headache, diarrhea, bronchospasm. Uses. What are the uses of the histamine? Why the histamine is used in which condition? So see here, histamine has no therapeutic value, means in medically it has no therapeutic value because it is a harmful substances that causes the inflammation, allergy, as gastric acid increases as a neurotransmitter, or immune inflammation. We had studied in the 4 receptors now, so it has no therapeutic value, but it is used in some diagnostic tests for diagnose the any condition or diseases. For example, testing gastric acid secretion, diagnosis of pheochromocytomia and pulmonary function. For this purpose, the histamine is used as a diagnostic kits. Okay, so this is all about your histamine uses, adverse effects, pharmacological action, histamine receptors, as well as their functions, mechanism of action of the histamine, definition and site, location, synthesis and distribution and storage. After the histamine agonist, we are going to discuss about antihistamines. What are these antihistamines? Yes, so we pharmacology students, we also know the definition of antihistamines. Means these are the agents which block the histamine receptors, that can be either H1 or H2 receptors blocker, or H3 and H4 also included in this. But B.Pharma students, you have in syllabus H1 and H2 receptor, so here only H1 and H2 receptor is maintained. So those agents which block the histamine receptors, by blocking the histamine receptor, what happen? Histamine do not produce their action. Okay, so what is the mechanism of the histamine? Any substances that binds to the histamine receptor, then only the action will be produced. If the histamine receptors is blocked, so histamine do not able to produce its action. So these are the agents that block the histamine receptor and as well as histamine actions by either blocking of the H1, H2 receptors or H3, H4 receptor. That those agents are called as the antihistamine. What are the classification of antihistamines? So mainly antihistamines are classified into 2 types. First one is H1 receptor or antagonist and H2 receptor antagonist. So those agents who blocks the H1 receptor antagonist are the first again it has a sub classification of H1 receptor antagonist: first generation histamine, second generation histamines, and first generation and second generation histamine and second generation histamine. So in first generation, there it is again subclassified into sedative, highly sedatives, moderate sedatives and mild sedatives. So highly sedatives example is diphenhydramine, promethazine, hydroxyzine. Mildly sedatives examples are phenyramine, meclizine, buclizine and cinnarizine. Mild sedatives examples are chlorpheniramine, dexchlorpheniramine and cyclizine. Second generation, the subclassification of the H1 receptor antagonist. Second generation antihistamines example are the cetirizine, fexofenadine, loratadine, levocetirizine and azelastine. So these are the second generation antihistamines. So first generation, all sedatives are included that blocks the H1 receptors. Second generation histamines, all the drugs. Okay, and H2 receptor antagonist. So see here, H2 receptor antagonist are those drugs which are also used to inhibiting or antagonist of the gastric acid secretion. Okay, proton pump inhibitors. Proton pump inhibitors are also called as the H2 receptor antagonist because it blocks the gastric acid secretion. Example is cimetidine, ranitidine, famotidine, roxatidine. You can also write as the proton pump inhibitor. Example, these are also the proton pump inhibitors. Example, cimetidine, ranitidine, famotidine, roxatidine. So these are the examples of this classification of the histamine, antihistamine. So see here, mechanism of actions. H1 receptor antagonist. Okay, H1 receptor antagonist, mechanism of action, how it acts to block the H1 receptor, H1 histamine receptor. What is mechanism of action involved in this? Means H1 receptor antagonist, first it competes with the histamine for binding to H1 receptor on target tissue. Okay, here I will explain by diagram. Okay. Assume this is the tissue. This is the tissue, and here the H1 receptors are present. Okay, H1 receptor, and this is the histamine. So in normally what happens means histamine comes bind to these receptors. After the binding, it produces the pharmacological actions. Pharmacological actions like increase in the, what are the pharmacological actions of this H1 receptors? Increases the capillary permeability, increases the vasodilation, causes the vasodilation or all. This is the normal mechanism of action of H1 receptors. So what happened here? H1 receptor antagonist. Sorry, I don't have that much clarity of my camera. What happened means H1 receptor antagonist is there na. It comes and competes with this histamine. It comes and binds with this histamine and forms a complex. And prevent, and by form this it prevent the binding of this to H1 receptor, other than it binds here, but it do not produce or form the bind of this receptor. So what happened? The histamine could not able to bind with H1 receptor and pharmacological action, so it all is inhibited. So this is the simple mechanism of H1 receptor antagonist. I have explained in this schematic manner. Yes, another action. What happened when this get blocks means you can write here opposite action of this histamine. One H1 receptors. You can tell me one by one. What happens? H1 receptor do increases the vasodilation, so it also downfalls the decrease in the vasodilation, decrease in the edema, decrease in the bronchoconstriction. Okay, that relief in the allergy. Okay, so what are the action of the H1 receptors? The H1 receptor antagonist reverse that actions. it means it increases, means it causes the decrease of all these actions. Yes, this is all this mechanism of action: relief, allergy, CNS penetration. Next, we go to the pharmacological actions. Yes, so what is the pharmacological actions of H1 receptor antagonist? So first one in antagonism of the histamine. Yes, it antagonizes the histamine, it blocks the histamine. Anti-allergic action, of course, you can see histamine causes the allergy, means it causes the anti-allergy. Central nervous system, you can see central nervous system, because it has no action of the central nervous system. Anticholinergic action, local anesthesia and blood pressure. Okay, so yes, antagonism of histamines means blocks the histamine, induce bronchoconstriction, control intestinal smooth muscles, and triple response, especially wheal, flare, redness or itch. So these are all the pharmacological action of the H1 receptor on the blood vessels. So it blocks the all action. You can write here the reverse action of that H1 receptors. Blocks the fall in the BP produced by the low doses of the histamine. Okay, but additionally H2 receptor antagonist required for complete blockade of that caused by the high doses inhibit the release of the adrenaline from the adrenal medulla. In response to histamine inhibits the release of the adrenaline from the adrenal medulla. Antagonizes the constriction of the large blood vessels by histamine. And action of histamine on gastric secretion is not affected by these drugs. Means, yes, because of gastric acid secretion is produced by H2 receptors. Now, so this is the H1. So it do not affect on the gastric acid secretion. Or other than all effects is blocked by this H1 receptor antagonist. Anti-allergic reaction, it causes the suppress the manifestation it suppress the immediate hypersensitivity like type 1 itching, urticaria, etc. Prevent partially anaphylactic fall in the BP. Central nervous system, because penetration across blood-brain barrier. Yes. The main points see here. What we discuss in the classification of the H1 receptor antagonist, in first generation we discussed the 3 sub classification. One is mild sedatives, moderate sedatives and highly sedatives. So what is the meaning of the sedatives? That is responsible for the depression of the CNS, causes the sleep. So it causes the crosses the blood-brain barrier and affinity for the central H1 receptors. Also block the H1 receptors. So first generation antihistamine produces the variable degree of CNS depression like sedatives. Yes. Anticholinergic action means many H1 blocks the addition antagonist muscarinic action of acetylcholine. Okay. Yes. So those drugs which block the muscarinic receptors also. The anticholinergic action can be graded as a high, low and minimal. So these are the drugs that come from the H2. Second generation. Cetirizine, fexofenadine, see here. So those drugs who have a high level of the anticholinergic action are promethazine, dimenhydramine, phenyramine, low chlorphenyramine, hydroxyzine, cyproheptadine. Absent or minimal means fexofenadine, cetirizine and loratadine. So this is the action on the anticholinergic action by H1 receptor antagonist. Local anesthesia, yes, phenyramine, promethazine, diphenhydramine have a strong, while other have a weak membrane stabilizing property. However, they are not used clinically as local anesthetic because they cause irritation when injected subcutaneously. So these are the high effectively drug phenyramine and promethazine. That produces local anesthesia action. So these are low recommended to use of H1 receptor antihistamines. On blood pressure, promethazine causes direct smooth muscle relaxation or alpha adrenergic blockade that causes the fall in BP. All over it causes the fall in BP. Pharmacokinetics. Yes. So you people have idea of pharmacokinetics. What is this pharmacokinetics? You already studied in your previous classes. You are seeing this video means you are already a senior, or you study from like pharmacokinetics, dynamics, receptor, agonist, antagonist. You crosses all that stages, then come here. So pharmacokinetics means it is well absorbed from the oral and parenteral, metabolism in liver, excreted in urine, they widely distributed in the body, enter in the brain because of sedative action. The newer second generation compound penetrates brain poorly, of course, because they have an anticholinergic action. So, and according for the low abscess and adverse effect, drowsiness, tachycardia, hypotension, urinary infection, increasing appetite, dry mouth and worse. Yes, so what is the uses of this H1 receptor antagonist or antagonist? Like these are used in the allergic disorders, cough, common cold, motion sickness, vertigo, Parkinsonism, acute muscle dystonia, sedative, hypnotic, anxiety, pre-anesthetic medication. So these are the therapeutic uses of this class of drug. See, once you understand this pharmacology topic, like mechanism of action, pharmacological action, so it is you people to write down the adverse effect and uses easily, very easily. Next one is H2 receptor antagonist. H2 receptor antagonist, yes. So what is the work mechanism of H2 receptor antagonist? H2 receptor histamines, H2 histamine receptors. It causes the increases in the gastric acid secretion by increases in the CAMP, cyclic adenosine monophosphate, that increases the intake of hydrogen potassium ATPase, that causes the increase in the gastric acid secretion. So H2 receptor antagonist, what can happen, it blocks that pathway, that mechanism CAMP, decreasing the CAMP, and it causes low or inhibited the gastric acid secretion. Yes, so these are the first class of highly effective drugs for acid peptic disease, but we have been suppressed by proton pump inhibitors. So what happened when in exam, when they ask about the H2 receptor antagonist or proton pump inhibitor, you write the same answer for both H2 receptors and proton pump inhibitors. Both have a same answers. Okay. Yes, pharmacological actions like H2 blockade. Yes, it is the main mechanism. Now how it produces action? By blockage of the H2 receptors only. Yes, block histamine, gastric acid secretion, cardiac stimulation, uterine relaxation, bronchial relaxation. Yes, gastric acid secretion inhibited the gastric acid secretion on all phases like basal, psychic, neurogenic, gastric of secretion, suppressor dose, all. Pharmacokinetics. So cimetidine most highly effective drugs among the H2 receptor antagonist. So it can absorb orally. Bioavailability is 60 to 80 due to hepatic metabolism, due to liver metabolism. It crosses the placenta and reaches the milk, but penetration in brain is poor because of hydrophilic nature. It has a hydrophilic nature, like aqueous nature, so it do not crosses the blood brain barrier. Yes. Next is aggregated unchained urine exerted by unchained urine and bile. Okay. Eliminated is half time is 2 to 3 hours. What are the adverse effects? Headache, dizziness, bowel upset, dry mouth and rashes occur. Hepatotoxicity rare condition. Uses it used in the peptic ulcer, stress ulcer, gastric Jolin-Ellison syndrome, GERD disease and prophylaxis. Jolin-Ellison syndrome, it is the moderate disease of the gastric or gastric secretion that causes the ulcers in the stomach. That condition is called as the Jolin-Ellison syndrome. Yes, so finally we have completed your histamine topics, histamine, antihistamine. So this is a very important topic for you all people. You don't have, if you want a notes of this, comment me, I will share you notes. And you do not doubt, I make a notes from the high author book recommend K.D. Tripathi. Yes, this is my favorite book. I make a notes from this K.D. Tripathi, Ragan Dales, H.L. Sharma, Padmaja and all. Okay, if you want these notes means comment me, I will share you a notes.